Today, if you're a high-performing community health center, these 3 things are on your priority list: expanding revenue sources to diversify, improving care quality and outcomes, and increasing margins to ensure financial viability. Obviously, all 3 need to be addressed. But looming policy changes have created a future of uncertainty. And for many, that means increased funding pressures, spending cuts, and a reduction in much-needed expansion efforts. Even if financial stability is restored, health centers operate on thin margins, so they usually have to tackle them one at a time. But what if you could advance all 3 simultaneously with no upfront costs, staff increases, or capital investments? That would be a real advantage. Health centers serve 27 million of our nation's most vulnerable populations. These patients are at high risk for acute health disparities and typically experience multiple chronic conditions, including behavioral health disorders. That's why supporting the overall health and well-being of these patients can be challenging. To be successful, health centers need comprehensive care coordination to address the patient's clinical, behavioral, financial, and psychosocial needs. This is critical to effectively managing their conditions and improving care quality. But getting patients activated, keeping them engaged, and helping them manage their conditions between office visits is resource intensive. And historically, you haven't been reimbursed for it. Now, you can be. Recently, the Centers for Medicare and Medicaid Services began new programs that reimburse health centers for providing population health management services. For example, by meeting CMS requirements, you can bill an average of $62 per month per patient for care management, $145 per month for behavioral health management, and $238 for annual wellness visits. That means if you were to enroll 1,000 of your eligible Medicare patients, your health center would see an estimated revenue increase of $2,722,000 annually. And for larger centers with 5,000 patients, the increase is more than $13.5 million. Problem solved, right? Not exactly. These care management services require a combined minimum 80 minutes of non-face-to-face clinical staff time per month, directed by a physician or other qualified healthcare professional. And the annual wellness visit program requires a 45 to 60-minute health risk assessment prior to their visit. If you enroll 1,000 patients in each of these programs, that's 14,000 hours per year just for the clinical consultations and assessments, plus the additional time for documentation and billing. Since compliance is essential for reimbursement, clinics may need to invest in technology, staff, and training to successfully meet the requirements on their own. This can get costly. But what if you could participate in these programs without the addition of staff or upfront costs? Here's where we can help. Our care coordination teams, nursing, and clinical support staff will perform as an extension of your health center, eliminating the need for additional technology and staff. We'll talk monthly with your eligible patients about adherence to physician directives and medication orders, develop care plans and set goals, and we'll even coordinate care among physicians, caregivers, and support services. Using motivational interviewing and healthcare coaching techniques, our highly trained care team will empower patients to better manage their conditions and improve outcomes. And they're absolutely obsessed with patient satisfaction and quality improvement. Meeting these CMS billing requirements will create new revenue streams with no upfront costs or capital investments, and it will go directly to your bottom line. The Vigilance Population Health service lines are a natural extension of your efforts to improve quality, leverage value-based payment models, and expand population health strategies. For more information about these programs, we encourage you to visit www.vigilancehealth.com or call us at 855-599-2261 to speak with one of our population health management professionals.